Hello everyone, today in our series of Docplexus interviews, we have with us a reputed interventional neurologist, Dr. M. Pradeep, who is the head of Department of Neurosonology at KG Hospital and Postgraduate Institute in Coimbatore. He is also associated with Wellcare Hospital and Neurocare in Kerala. Dr. Pradeep is a recipient of prestigious National Merit Scholarship and University Merit Scholarship. He has published numerous research articles in prestigious journals and presented many papers at various conferences. He has an expertise in stroke and neurovascular sonology and transcranial Doppler. Thank you so much, Dr. Pradeep, for joining us today for this interview. Can you brief us on the use of transcranial Doppler for the evaluation of hemodynamics?
Yeah, this transcranial Doppler is a relatively new modality which has come into practice and for the use of neurologists, especially in assessing neurovascular disorders. This is a really useful bedside investigation which is relatively easy to do and which does not need much of a patient cooperation. At the same time, gives us real time evaluation of cerebral hemodynamics, especially the blood vessels at the base of the brain can be arteries of the blood flow of the arteries of the brain or the base of the brain can be studied well, including your middle cerebral artery, anterior cerebral, the posterior cerebral, the terminal ICA, the carotid siphon, your PCAs, vertebral artery and the basilas can be studied well in detail with this bedside investigation, and we get almost will get a very clear cut idea of what is the blood flow in these vessels, the flow velocities, whether there is any evidence of intracranial stenosis in these vessels with a sensitivity and specificity more than 90%. That is, it is almost comparable to angiography.
So, according to you, what is the best strategy to improve patient outcomes in carotid artery stenosis?
Yeah, if we are talking about carotid artery stenosis, it all depends upon whether it is a hemodynamically significant carotid stenosis or it is not hemodynamically significant. Hemodynamically significant carotid stenosis is not just by the percentage of stenosis what was previously thought of. Previously the criteria was it is somebody having 60% or above 70% is a critical stenosis. But now we know somebody is having a bilateral carotid stenosis, say one side 70%, other side 80%. Which side you should open up first, either by stenting or endarterectomy? In that case, again the transcranial Doppler comes into extreme use, because we routinely get this question from our vascular surgeons whether we should do a carotid endarterectomy on which side. Suppose this patient is having bilateral, we do what we look at the vasomotor reserve in these patients by doing a transcranial Doppler examination, and we can tell us which side is the hemodynamically significant stenosis or what is the status of the intracranial collateralization. If the intracranial collateralization is not good, you should do the carotid revascularization procedure. And when you are thinking in terms of a carotid revascularization procedure, there are two modalities which you have in hand. One is a carotid endarterectomy and now is a carotid stenting. The carotid stenting has now increased more actually compared to previous times, because now the safety of carotid stenting has improved. You can do a procedure of a carotid stenting if you can think of a procedure related complication less than 6%, which is the internationally acclaimed figure for the carotid endarterectomy. So, if you can manage your carotid stenting with less than that much percentage of a problem for the patient, you can very well do a carotid artery stenting. And now we have clear cut guidelines for during carotid artery stenting, depending on whether there is a post radiation stenosis, whether the stenosis is higher up, whether there is any previous neck surgeries, then you will always think in terms of doing a carotid stenting instead of, and suppose you are to getting a restenosis, you do a carotid artery stenting instead of a carotid endarterectomy. And now with the present devices, and we can very well do a very safe carotid artery stenting procedure. That is why now the carotid artery stenting has increased, the procedure has increased considerably comparing to the previous times.
So in India, the prevalence of stroke is quite significant. So do you think there should be a national guideline to prevent this?
Absolutely right. There should be a national guideline, because stroke comes under the top 3 killer diseases of the world, apart from myocardial infarction and malignancies, cancers. So this is the problem with stroke is, it is not only causes mortality, the morbidity associated with stroke is extremely high. And imagine now the incidence of young stroke is also high. Young stroke, by young stroke what I mean, less than 65 years of age, and he must be a potential breadwinner for the family. So if such a person develops a stroke, it produces not only an emotional problem for it, is an economic burden also for the family. So what is happening? Why the incidence of stroke is increasing? In India, if you look at the present statistics, every minute there are 3 patients developing a stroke. These 4,500 patients develop a stroke in India every day. That is the present statistics, which means almost 3 patients every minute. So this has to be prevented. This has to be prevented, because the long term morbidity associated with stroke is tremendous, putting a lot of burden on the family, on the state health services and the economics. So if we can prevent this devastating disease by a lot of patient education to the public, to lead a healthy lifestyle, quality of life, proper exercises regarding the diet, and regular medical examination checkup, especially control of hypertension, that is one of the foremost forerunners for stroke, and control of diabetes, avoiding smoking, excessive alcohol intake. All these things can help in preventing a stroke in the long run, and that is going to develop a nation which is much more healthier and producing a less economic burden for the country.
Can you elaborate on the recent advances in the pharmacological management of ischemic stroke?
See, the pharmacological management of ischemic stroke has now has improved considerably. You know that the first the ideal drug, is thrombolytic drug for stroke, is yet to come. But in 1996 there was the major change in the management of stroke by the development of recombinant tissue plasminogen activator after the NINS trial. That was when the NINS trial got published, and 1996 US FDA approved the use of recombinant tissue plasminogen activator for the management of acute ischemic stroke within the time window of 3 hours, and subsequently the ICAS 2 trial, ICAS 3 subsequently extended it into the 4.5 hours time window for managing ischemic stroke. But from 96 up till 2016, it was only TPA which was available for use for ischemic stroke. But now in 2016 June 28, Government of India approved a new thrombolytic drug called tenecteplase. This tenecteplase, the first country to approve tenecteplase in the world is India. So all Indians should be proud of that, because here is something which has been given to the world by our country. So this drug is extremely useful. It is more powerful than the recombinant tissue plasminogen activator, and is absolutely safe. The incidence of symptomatic intracerebral hemorrhage is much less when compared to recombinant tissue plasminogen activator. All the more, it has been proven by the ASCET trial that in myocardial infarction, which they were using RTPA before, but after the tenecteplase has come, now for myocardial infarction, it is more than 15,000 patient data, which proved that this is much superior to recombinant tissue plasminogen activator. And now our trial in India, we have proved that this is equally efficacious, at least for with TPA for management of acute ischemic stroke, with less of complications in the form of symptomatic intracerebral hemorrhage. And much better thing is the ease of administration. It can be given as a single bolus, whereas the RTP has to be given as an infusion over 1 hour. And as far as India is concerned, the prime reason for the less usage of recombinant tissue plasminogen activator was the cost of the drug. The cost of the drug is not everybody could not afford the drug, but the present drug is almost 1/3 the cost of the previous drug. So that makes it economically viable and feasible for all the acute stroke patients to take. So that is one of the best things which has happened, and we are the forerunners as far as we are leaving the footprints for the other people to take.
So we are certainly proud of that fact. So do you think an online community of doctors can help raise awareness amongst doctors about such new drugs and about other medical information?
It's absolutely essential, because for all medical meetings, all conferences, I don't think every doctor will be able to attend. So because of so many reasons, because when a sick patient is admitted under them, it is impossible. They may be planning to come for a meeting, last minute it can get cancelled. One is for the professional reasons, other for the personal reasons. So if there is a online forum where all these things are put forward, and at their leisure they can go through it, and if they find it is useful for their practice, they can take it.
Thank you so much, Dr. Pradeep, for joining us for this interview and for sharing your valuable time with us.
Thank you for inviting.
To stay updated on our latest KOL videos and interviews, please follow us on Twitter, like us on our Facebook page, and subscribe to our YouTube channel. Happy Docplexing!